Assalamu alaikum beta. In this video lecture I will deliver the lecture on pre-malignant condition of the skin, okay, that is actinic keratosis, also known as solar keratosis. Okay, this is the pre-malignant condition. This is pre-malignant tumor of the skin, epidermal tumor, and it has high potential to develop into malignant cancer of the skin, that is squamous cell carcinoma of the skin. Okay, there are two main malignant conditions of the skin. Number one is squamous cell carcinoma and number two is basal cell carcinoma. Okay, and the pre-malignant condition which we will discuss in this video lecture is actinic keratosis, also known as solar keratosis. By the way, it is a benign intraepithelial neoplasm. As I said, it is the intraepidermal or intraepithelial neoplasm, and it is obviously benign, but it has full potential to develop into malignant condition. Okay, if we talk about the pathogenesis of this actinic keratosis, then you will have the better understanding. Better due to chronic exposure to sunlight, okay, or some other factors, but the main thing is chronic exposure to sunlight, and that's the reason we call it solar keratosis as well, because its main link, its main risk factor is chronic exposure to sunlight. Okay, so chronic exposure to sunlight and some other risk factors that may or may not be there, but okay, if they are there, then they do participate, like ionizing radiations, industrial hydrocarbons, and exposure to arsenicals. These are also the risk factors that may participate. Okay, so when you are exposed chronically to sunlight, or there may be some other risk factors as well, you know beta what's going to happen. There is dysplastic proliferation of keratinocytes, that is uncontrolled and abnormal proliferation of the keratinocytes. Okay, keratinocytes are, by the way, the cells of your epidermis. Okay, epidermis, you remember all the 5 layers of epidermis, 4 to 5 layers of epidermis, and the cells of that epidermis are obviously called squamous cells or keratinocytes. Why keratinocytes? Because they produce keratin. So due to these risk factors, there is uncontrolled abnormal proliferation of keratinocytes, and once the keratinocytes have proliferated very much in the dysplastic fashion, what's going to happen beta? There is hyperkeratosis as well as parakeratosis. What does these two terms mean? Hyperkeratosis is, that is, increased keratin production. Why is there increased keratin production? It is due to अनकंट्रोल्ड वेरी मच प्रोलिफरेशन ऑफ केराटिनोसाइट्स. तो बेटा जाहिर है केराटिनोसाइट्स का नंबर बढ़ेगा तो वो केराटिन प्रोडक्शन भी ज़्यादा करेंगे. ठीक है, सो दैट इज़ हाइपर केराटोसिस. ओके, what is parakeratosis? That are abnormal cells of the epidermis, especially in the stratum corneum. Normally what happens, let me quickly explain it here, that this is your epidermis, and in epidermis the cells which are especially in the top layer, the cells, if I take the cell out, then they do not have nucleus. They do not have nucleus normally. Normal mature cells of the epidermis, nor again I am repeating, the normal mature cells of the epidermis, especially in the stratum corneum, they lose their nucleus. Okay, but in case of actinic keratosis, you will come to see immature cells will be present here. That means these cells will be retaining nucleus. Okay, these are the immature cells that are retaining nucleus, and they are abnormal, and this is called parakeratosis, by the way. Okay, so are you clear so far beta? Yeah, so there is uncontrolled abnormal, that is dysplastic proliferation of keratinocytes, that will lead to hyperkeratosis, that is increased keratin production, and parakeratosis, that is abnormal epidermal cells which are retaining nucleus. Okay, right. One thing that I need to mention here is the incidence of developing actinic keratosis is very much high in lightly pigmented individuals with fair skin. तो बेटा जाहिर है जिनकी fair skin होती है उनमें स्किन में मेलानिन कम होता है, और मेलानिन का आपको पता है वो बड़ा प्रोटेक्टिव पिगमेंट है, आपको सनलाइट के हार्मफुल इफेक्ट से बचाता है. तो अगर आप बहुत ज़्यादा फेयर स्किन हैं तो दैट मीन्स योर स्किन इज़ नॉट हैविंग सफिशेंट मेलानिन. सो ड्यू टू दैट रिड्यूस्ड मेलानिन, you are exposed to harmful effects of sunlight and you may develop actinic keratosis. Okay, so once this has happened in the skin, let me even show you. Let me show you the hyperkeratosis and parakeratosis in the histological picture of the skin. Can you see in this picture beta? Just let me quickly adjust. Yeah, can you see? Just, yeah, zoom it in. Yeah, this is the hyperkeratosis. Can you see this thick layer of the keratin on the skin? This is hyperkeratosis. And can you see, yeah, here. Can you see this entire is the epidermis. This entire is the epidermis. Can you see? Sorry, this entire is the epidermis. And can you see these cells? Can you see these cells? Can you see these cells? All these cells are retaining this dark blue nucleus or purple nucleus inside them. This is parakeratosis. Can you see cells inside which there is nucleus retaining? This is the cell which is retaining nucleus. Okay, normally there should not be this nucleus, because the normal mature cells, they do not contain nucleus inside them. Okay, but if you are suffering from this actinic keratosis in which there is dysplastic proliferation of cells, so there is number one hyperkeratosis, that is this much thickening of the keratin layer, and this is parakeratosis, that the cells are retaining the nucleus. Okay, yeah, now this is the histological imaging of the skin. But how this condition appears on the skin, how it looks, how is what is the appearance of this actinic keratosis on the skin? Let me show you. This is how it appears on the skin, beta. Can you see the line of the actinic keratosis? Let me quickly set it here. Yeah, how it appears on the skin. In case of actinic keratosis, beta, there are patches on the skin. Okay, can you see this patch? It may be tan brown or red or skin colored like this, and it is having very much rough surface. Okay, sandpaper like consistency. और मैं आपको एक बात लाजमी इसमें बता दूं बेटा कि ये तो अर्ली कंडीशंस हैं, और जो आपकी एक्टिनिक केराटोसिस है उसमें आपको पता है हाइपर केराटोसिस होती है. अगर ये हाइपर केराटोसिस बहुत ज़्यादा हो जाए और केराटिन प्रोडक्शन बहुत ज़्यादा एक्सेसिव हो जाए तो केराटिन के हॉर्न्स बन जाते हैं स्किन पे कुछ इस तरीके से. दिस इज़ वेरी मच सीवियर कंडीशन. कैन यू सी दिस स्मॉल हॉर्न्स? Can you see these small horns? This is very big. Okay, this is very big horn. This is due to overproduction of the keratin. Okay, and this is very severe stage of the actinic keratosis and high potential to develop into squamous cell carcinoma. This is due to keratin production, overproduction of keratin. By the way, in actinic keratosis there is hyperkeratosis every time, but if that hyperkeratosis become very much increased, then this is what you can see. Okay, yeah, look at here. If excessive keratin, then there is cutaneous horns appearing on the skin. Okay, they resemble actual animal horns. Okay, and where on your skin these lesions develop, the lesions of actinic keratosis, they do develop on the sun exposed sites, especially on the face, arm and the dorsum of the hand. And one thing that is associated with actinic keratosis is actinic cheilitis. This is what happens with your lips in case of actinic keratosis. This is called actinic cheilitis. Okay, yeah, are you clear till here? Yeah. Okay, now let's have a look at some morphological features of the actinic keratosis. Yeah, morphological features. What did we learn so far, by the way? What did we learn so far? That yeah, there is hyperkeratosis and parakeratosis. Okay, I showed you the histological slide in which I showed you both the things, hyperkeratosis and parakeratosis, and then I showed you a picture in which there was the appearance of the lesion on the skin. Okay, it was very much rough and patch, and later if there is excessive keratin production, then how it becomes more like a cutaneous horn. Okay, some morphological features include that in case of actinic keratosis, the lowermost layer of the epidermis, which is the basal layer, it shows cytologic atypia. That means the cells in the basal layer, they show cytologic atypia. That means the cells become very much atypical. What does it mean? It means their cytoplasm become pinkish or reddish. Okay, and by the way, the bridges are present between two cells in the lowermost layer, especially in the basal layer. The intercellular bridges are present. Why did I tell you this? Because we have to compare this thing with the basal cell carcinoma later. In case of basal cell carcinoma, the intercellular bridges are absent. Okay, so far in the morphological features, what did we learn, beta? That if let's suppose this is your epidermis and this is the lowermost layer of the epidermis, that is basal layer, so the cells of this basal layer, they are very much atypical. That is called cytological atypia. And what does it include? Their cytoplasm becomes pink, or their cytoplasm becomes reddish, okay? And the cellular bridges between two cells, they are still present. Why did I tell you this thing? Because we have to compare this thing with BCC, basal cell carcinoma, in which these bridges are lost, okay? And one more thing I have to tell you in morphological features related to this basal layer, that is, in basal layer at some places there is hyperplasia of the cells, and at some places there is atrophy of the cells, leading to thinning of the epidermis. If I again draw the same thing for you, this is the epidermis, and this is the basal layer. At some places there is hyperplasia of the cells, at some places there is atrophy. So some places epidermis is thick, and at some places there is thinning of the epidermis, okay? Yeah. And one more histological morphological feature of the actinic keratosis include that if this is your epidermis beta, then here is the dermis. Let's suppose in superficial part of the dermis there is elastosis. What is elastosis? Abnormal elastic fibers are present which produce elastosis is there in the superficial dermis. So that means there are thick blue gray elastic fibers. Yeah, these are the abnormal elastic fibers, and they are being synthesized from the sun damaged fibroblast, okay? When there is chronic sun exposure, so this is your dermis now, okay? When there is chronic sun exposure, then the fibroblasts that are present in your dermis, they become damaged and they become abnormal. So they keep on producing lots of abnormal fibers of the abnormal fibers that are very much thick and blue gray elastic fibers, okay? This is the morphology of your actinic keratosis, right? Now let's talk a little about the treatment plan of actinic keratosis, because actinic keratosis has very much high potential to develop into squamous cell carcinoma. We need to eradicate it as quick as possible, okay, as early as possible, so that it does not develop into squamous cell carcinoma. And the local eradication can be done by gentle curettage of the lesion, okay, or by providing it very low temperature, freezing it, okay, or topically applying chemotherapeutic agents over the lesion. And at number 4 you have topical imiquimod can be applied over the lesion. What is the mechanism of action of this topical imiquimod when you apply this over the lesion? By the way, it causes TLR activation, that is toll-like receptor activation. Once this toll-like receptor activation occurs, then in your skin innate immunity becomes activated. And you know what beta this does? This innate immunity quickly recognize your actinic keratosis cells and eradicate these precancerous lesions, okay? This is number 1 thing that this imiquimod can do. Number 2 thing is direct apoptotic effect on the keratinocytes, okay? Imiquimod, by the way, it works by activating TLR and innate immunity, but also apart from this imiquimod has got its direct apoptotic effect on the keratinocytes as well, okay? So directly killing the dysplastic keratinocytes. Yeah, so that's it beta. That's all about the actinic keratosis. Hope you are very much clear. If you have any question, you can ask me anytime, anywhere. Class dismissed.